I have been covering this pandemic from the beginning. You've been part of responding to this pandemic from the beginning in a couple different roles. Throughout the pandemic, the view of public health agencies has weakened. If you're looking at polling, public trust has fallen in agencies like CDC and others. What is your message to Americans who feel frustrated with how the public health apparatus, our public health system, has responded to the pandemic?
Um, this has been challenging times. There is no question about it. As you said, I've worked in this in different roles. For the first year of the pandemic, I was running a clinical division at the hospital level in the very beginning when we had our first cases in Boston, at the patient bedside. It has been challenging for the entire 2.5 years. When I came into the administration, I said that we were going to be making decisions based on science. That remains true. What I didn't say, which was implied, but I think we should articulate, is that science moves, that science changes, and sometimes we have to make decisions in the absence of all the data and all the science that we would like to have before all of that information is available. That is very hard in a pandemic. People want to understand a decision and have it not move. But my responsibility to the American people and to populations and to individual patients is to deliver the best information that I have at the time, and sometimes that has changed. I will tell you that since the beginning, since that first case that we had in early March 2020 in Boston that we saw, we have had a Wuhan variant, we have had Alpha, we have had Delta, and now we've had 4 or 5 different Omicron variants. Not all of them behave exactly the same, and it is my responsibility and the responsibility of this agency to move as that virus moves.